So let's go on. You saw the family here. You've probably heard a lot about stem cells by now. There's a lot of buzz about stem cells in the news, on TV, and all the successes that have occurred with stem cells. Or maybe you know somebody who's had a treatment and has had a lot of success. So what is a stem cell? A stem cell is an undifferentiated cell that has the unique capability to turn into any type of cell, whether it be a cartilage cell, muscle cell, brain cell, liver cell. It serves as an internal repair system for the body. So if something is damaged, the stem cell will go to the area and regenerate and heal. Now, we focus a lot on osteoarthritis because there's a large population of people that are living in pain, and we've seen such good advances with osteoarthritis and patients being able to avoid the debilitating surgery of replacement surgery. So traditional treatment, let's go over, versus stem cell therapy. The U.S. pays over $10 billion in surgical costs for hip and knee replacements annually. The average person suffering from knee pain avoids having a knee replacement for about 13 years. During that time, he or she spends about $35,000 on steroid injections and pain medication to manage their symptoms. That's a huge expense of time, money, and quality of life. So it's true, when a patient finds out they have moderate to severe arthritis, they start getting knee pain, they'll probably follow up, or joint pain. They'll see their orthopedic surgeon. At that point, they'll start out with a steroid injection, which you know is anti-inflammatory, but is only temporary. Or maybe they go on to have a gel shot like a hyaluronic acid, and that's also only approved for about 4 months. Then there's physical therapy and all the costs and deductibles that occur with pain medications that patients are going through. Then they decide to have a knee replacement after they suffer for about 13 years. And when they have the replacement, there's costs involved with that, along with physical therapy and a lot of downtime, about 6 months of recovery for that. So when you look at a joint replacement, still about 20% of the people are left with significant pain after their joint replacement. There's a long recovery time, limited mobility that can last months. And 2% of the patients can have complications. The risk can include blood clots, heart attacks, strokes, infection, and even death. So when you think about the difference now, we have stem cell therapy. We have an alternative option to joint replacement. This is a non-surgical and regenerative therapy. It actually regrows cartilage back in the joint space. Patients experience minimal discomfort during the procedure. It's a small injection that they can actually get up and walk out of the appointment that same day. There's no sedation and no downtime. And the symptoms can begin to improve within 1 to 2 months of the treatment. The cost of the stem cells we went over, the treatment is a fraction of the current expenses of the joint replacement. And there's no safety concerns or adverse effects that we've seen. So why doesn't insurance cover this? The big question, right? Why doesn't insurance cover this? And the truth is, it's just too new of a procedure. Insurance companies typically want 10 to 20 years of data before they actually cover or adopt to pay for a new procedure like this. There is one state in Arkansas that's covering stem cells for government employees only. So hopefully the research, and it will continue with the data, that these other states will follow and cover it. We're thinking probably about another 5 to 7 years before the insurance companies cover. But again, the cost of the stem cell treatment is a fraction of current patient care, and we can save a lot of disability, discomfort, injection, surgery, and downtime with the stem cell treatment. And then we think, what is the cost to you? But not necessarily financially, but lifestyle. You know, what are the things that you enjoy doing that you're not able to do right now because, say, you're living in pain? So is it running? Is it just playing with your grandkids? Is it golfing, hiking? What would be the cost? Now, there's many different types of stem cells. Bone marrow stem cells have been around since the 1950s. They've been treating blood cancers like leukemia and lymphoma. But they're a little bit harder to get. You have to drill through the bone, maybe the iliac crest or the bone, to get the bone marrow, and it's more painful for the patient. Adipose stem cells is also an adult stem cell. This was Allure's preferred method for a long time. We found that there's 500 times more stem cells in your own fat than there is in the bone marrow. And it's easier to get. We did a mini liposuction procedure. We can separate the stem cells from the fat cells and then inject them back in the joint same day. Patients did wonderful with this. Umbilical stem cells, I would say, over the past year have really made a breakthrough. So now they're saying umbilical stem cells from a baby's umbilical cord are going to be more potent than your own adult stem cell. So a person over 60 years old, they say their own stem cell isn't as potent as this umbilical cord stem cell. So the umbilical cord stem cell is from a baby's umbilical cord, all healthy pregnancies in the US. Normally they would throw out the umbilical cord, now they donate them. So they take the stem cells, they purify them, clean them, and they test them for any known virus, HIV, hepatitis, cytomegalo, any virus that is known, just like a blood transfusion. But they take out all the red blood cells from the stem cells, so you don't have to be a match to these donors. I've never seen a rejection. I've never seen an allergic reaction from them. So they're safe. And this is not to be confused with embryonic stem cells, which comes from aborted fetuses. There's some ethical issues with the embryonic stem cell, and they're illegal in the US, so Allure does not participate with that. There's a couple other types of stem cells, amniotic, which we don't feel has as many mesenchymal stem cells as the umbilical cord. And Wharton's jelly is kind of coming up as a newer product as well. We had a couple reps in with Wharton's jelly, and we were talking about, I think it does have some potential in the future because there's a lot of interleukins and growth factors in there. But they couldn't find a study to show us that there's mesenchymal stem cells in the Wharton's jelly. And that's what we really know grows and regenerates the cartilage. So as science advances, we're going to continue to keep up with what's going to be the best treatment option. And right now it would be umbilical stem cells. So let's look at some statistics. We were involved in a study with 1,200 patients, and that was our practice and multiple physicians around the US. All of them were bone-on-bone or moderate to severe arthritis. We actually had about 1,800 joints because some patients had bilateral. Mostly hips and knees, I would say. So there was a 90% success rate that the patients had at least 50% improvement in their pain after the first injection. And they followed them for 1 year to 6 years. There was another study that showed 3 months after an injection, they did an MRI to actually see the difference before and after the stem cell treatment, and they found there was a 25% increase in cartilage, which is remarkable because nothing short of a knee replacement has shown that much increase in joint space. And the growth continued to last for at least 2 years following the injection. So the stem cells will continue to grow and regenerate, and we see the cartilage growth regenerating for at least 2 years. And then the improvement had last 5 to 7 years. So the patients after 5 to 7 years still had improvement from their initial first stem cell treatment. And then what happens after 5 to 7 years? So there might be some patients who are a little more active that will require an injection a little sooner. So what happens in 5 to 7 years, maybe you require another injection. Or maybe something else will be out. There's a company right now called Cellularity that's actually trying to bottle the growth factors in the stem cells in pill form so you can take a pill and regrow cartilage. So we're trying to avoid anyone, getting hardware in their knee, because once they get hardware or have a replacement, they're not a candidate anymore for regeneration. So we'll continue to stay up to date with these advances. Less than 2% went on to get a joint replacement in that study as well.
Question.
Yeah.
So I assume, based on the numbers that you put out, in terms of how long you provided this type of treatment,
right,
you have had people in the second cycle or second treatment cycle.
Right.
They've gotten to 5 or 7 years who said, I want to do this again.
Uh-huh.
Is that correct?
So we've been doing stem cells for 5 years, so we're just at that point. Yep.
All right. Is there any research to show
Mm-hmm.
that, say, after that first generation of treatment, people who've come back for the second generation of treatment, we're talking just about like knee and hip replacements,
Mm-hmm.
that next treatment is just as effective as a first treatment, or is there some resistance or degradation, like if you come in and have this treated multiple times over the course of years, that it's less effective maybe the second time?
Not necessarily. So I have had a couple patients that will come back yearly for another injection, not because they feel that they didn't respond, but that they want to get even more better. So they had so much improvement the initial treatment that they wanted to feel even more better with the second treatment. So if a patient fails the first treatment, it doesn't mean that they're not going to respond to the second. Most patients that we have had, if they did fail, we would now offer the umbilical stem cell treatment, which would be more potent. So we've been doing umbilical for the past year, and those patients typically haven't had to have another treatment.
Is this,
And if you wouldn't mind, I'm just going to finish the presentation, and then we'll have a time for questions as well, just so we can go through. Yeah, no problem. All right, so we went over the stem cell statistics just alone, but what happens if we add PRP to the stem cells? PRP is platelet-rich plasma. PRP has been around since probably 2009, when a lot of patients, and mostly pro athletes, have been getting injections in their joints to get back to sports a little bit faster. So PRP is your own blood that we actually draw your blood and spin down all the platelets, and then we can inject it in the joint with the stem cell. If you think about platelets, when you cut yourself, the first thing to the wound is a platelet. So it stops the bleeding, it clots the blood, and promotes the healing process. So what happens when you added PRP to stem cells, it increased cell proliferation, and we had more active, energized stem cells and better results. Then the next study added hyaluronic acid, the gel shot. And what that did was help the stem cells stick to the bone where we wanted the cartilage to grow. And that's why we add now, Allure adds all three of the products, stem cells plus PRP plus hyaluronic acid, and that's what's given us the best success rates. Continuous improvement, better, more consistent results. So here's an x-ray I had of a patient recently that came to us. This is her before photo, where you can see pretty much here it's basically bone on bone, and there's really not much space in between here. 6 months later, she had an elevation of that space in between there. And I talked about the MRI showing even better views of that space, and then even the arthroscope. So what we wanted to do, researchers wanted to know what that space actually is. So there was a study with 11 patients, and they went in and actually did an arthroscope with a camera to figure out what was that space. Indeed, it was high quality cartilage in that space. So we know the science behind stem cells, we know the space increased with MRI, and we know now the arthroscope showed that there's cartilage in that space. Treatable conditions, we have a lot of them now, and we're going to continue to advance that. But right now, joint pain, knee, hip, shoulder degeneration, and actually multiple joints, any joint that needs cartilage can really be injected with stem cells. Osteoarthritis, arthritis, multiple sclerosis, stroke, spinal cord injuries, COPD, most autoimmune conditions like rheumatoid arthritis, psoriasis, psoriatic arthritis, ulcerative colitis, Crohn's disease. We have our stroke, our spinal cord injuries, a patient who's 35 who had a diving accident, dove off a lake into the lake and broke his neck, was paralyzed. We're treating him now, 35-year-old. And he's remarkable. He's got about 4 umbilical stem cells, and he went from struggling to take one step, braces on his legs, blood pressure going up high, to now walking 5 to 6 laps around the track at physical therapy. So that's been amazing. So some of our stem cell therapy successes also, we have Nate. Nate was a stroke patient. He's 35 years old. He came in 3 weeks after his stroke, and you saw him probably on some of the testimonials. He went from not complete left-sided paralysis. Now he's able to live at home, take care of himself, went back to work, basically live a pretty normal life. Gloria, she had adipose, her own fat stem cell. She now is 1 year out, and she's able to walk up the stairs and ride a bike, which is what she wasn't able to do before. Thomas, he's a COPD patient. He's had 2 treatments of umbilical stem cells, COPD, chronic obstructive pulmonary disease. He went from, now he says, I can breathe. He can walk longer distances without being short of breath. He has higher pulmonary function testing. He's had less hospitalizations and less infections. And we know that with COPD or even the autoimmune conditions, it lasts for about 9 months to a year. So every 9 months to a year, these patients can come back for their next injection. We don't have anyone up here with multiple sclerosis, but Dr. Moak has an extreme energy in multiple sclerosis, which is also an autoimmune condition. And we found a lot of success with these patients that really don't have any other options as well. We treat their gut microbiome, because there's a lot of study and research on autoimmune diseases linked to the gut microbiome and changing over the bacteria of the gut, as well as stem cell therapy. Sometimes testosterone aids in increasing muscle mass and bone density for those patients. And then Karen on the end, she's an umbilical stem cell treatment to her knees, and she went from a 10+ pain down to a 6, 2 months after her treatment. And I just saw her 2 days ago. She's 6 months out now, and she's living in minimal pain, and she's able to do household projects that she hasn't been able to do in the past. And then lastly, we have our very own here, Darryl Thomas, who's also one of our stem cell patients that we treated a year ago. And he's here to talk about his improvements in pain. Woo! So come on up here.
How's everybody doing? Just to give you a little history about myself. I'm from Indiana, Northwest Indiana. I went to Western Michigan at the County Broncos. I had one Bronco, but she came from Kalamazoo.
Oh, wonderful.
Yeah. And she saw it on Facebook. I put it on Facebook.
Thanks for coming.
I had the procedure done a year ago at the end of March. And prior to that, I was bone on bone in both knees. Mm-hmm. And my passion is, I'll be 64 in July, and I still play competitive basketball every week. But it was painful prior to getting the stem cell injections. So I did my own research, because I spent 38 years in the pharmaceutical business, 10 years as a rep, 28 years as a manager. So I've covered all disease states. And it was one gentleman that goes to my church. He had it done probably about 3 years ago, but they really wasn't doing them in Michigan a lot. So he went down and had it done out of state. And so 2 weeks before I had the procedure, I said, Joe, how you doing? And his eyes lit up, because he still plays competitive softball, and he's 69 years old. He said, I am running full sprints again like I've never run before. I said, really? I said, but you couldn't run them sprints a couple years ago. He said, his eyes lit up again. He said, I am literally running full sprints. So I said, well, I don't know how much time I got left on this side, but I am going to, my whole thing about is quality of life. And the fact that, like, I've been in that pharmaceutical arena, so we had to preach about quality of life in terms of how well you take care of yourself. And so I did my research. I looked at Allure. I looked at some of the other companies that was offering it. And I feel for a reason sometimes God leads you to a certain direction, and he led me to, I call it Dr. D. So mine came from my abdomen area, and it was done the same day. I was back home, no downtime other than just normal activities for the first 48 hours. I didn't play any basketball for about 3 weeks. I just wanted it all to settle in. And I could tell that first night, because I have a 2-story house. The next morning when I got up and walked down the stairs, I didn't have any pain in my legs, in my knees. I said, whoa, this stuff is working pretty quick. I didn't think it was going to work that quick. But it's still a process. But when I went to play basketball 3 weeks after having it done, when I ran up and down the court, the guys were looking at me and they said, you haven't run like this in a long time. I said, I haven't felt like this in a long time. Because I had both my knees scoped back in 1988. And a very good friend of mine is an orthopedic surgeon. He said, well, I'll have you on the table pretty soon. I said, well, I'm going to try to avoid that knife at all costs, because I know what the process is of going through. I've seen people. I was just sharing with Sherry. We have a mutual friend in Arizona. She's 61 or 2. she's had 3 knee replacements. And one of them just totally shattered in her knee. So that was real painful for her. And she saw what I had put on Facebook. She said, I wish I would have saw this process maybe 2 or 3 years ago. But she's not a candidate now because now she's had both knees replaced. So, like I said, I'm back playing basketball. I'm going on my golf trip next week. And the big test after I had it done in March, normally when we go to Phoenix to play golf, we play 5 straight days. And I played 5 straight days without pain. And that was significant improvement for me right there. So it's a process if you're thinking about doing it. I've already referred, I think, 5 or 6 folks already to Allure that's had it done already. I brought one person there 2 weeks ago. I've never seen him walk as good as he's Isaac. He's got a little pep in his step now.
Good, yes.
And then there's one guy who called me. I had never met him, talked to him probably about 7 times. And he said, I'm going to get it done. But I had never met him, but so happened he was up there at the same time Isaac was. So I met him for the first time, and he came as a referral from somebody else I go to church with. He had the shoulder, hip, the knee, and the ankle done. So he's feeling pretty good.
Yeah.
And then there's a judge I referred. He's happy down at 36th District Court. And the thing that I'm most amazed about is most physicians, because one of the girls who used to work for me, her dad is a physician, Dr. Orr. He did it up there in Allure, and he's feeling better. But you would think doctors would look into more research for themselves, but sometimes they don't. So if you have any questions, I can answer them.
Well, were you injected with the stem cell with the plus?
Yes.
Okay, how would that, what would, I don't know if you can answer this question, what if you just did the stem cells, or don't you even offer that?
We don't really offer that. Actually, no one's ever asked me that question because we know the benefits of the plus. We know the benefits of...
I wondered what the additional benefits were, that's all.
Yeah, so stem cells alone has been studied quite a bit. And then stem cells with PRP has been studied. And then stem cells with PRP and hyaluronic has been studied. And the substantial increase in better results with all 3 together.
How do they compare with the umbilical stem cells?
Even better than that. So now we're saying that your own fat, after 60 years old, may not be as potent. Certainly we've had great results with patients using their own fat, but we're trying to stay up with science and what the research is showing there. And so the umbilical stem cells is more pluripotent. So these cells have not turned into any different type of cell. And they can divide faster, quicker, and provide better results with the umbilical versus the adipose. What we've seen, and what we've seen in the last year with umbilical is the patients improve faster than their own adipose fat. So maybe it's that they can turn quicker, they can regenerate faster, heal faster, create the cartilage faster versus your own fat, maybe a little bit more fatigued. Still, there's great results with your own fat, but I think that maybe it's a little faster turnover.
One more question that had to do with the Allure study. Those were Allure patients in the study?
No, we've had about 400 patients, Allure, but we were involved in a study with multiple physicians in the country. All
1,200?
Yes, and that was from 2013 to 2018.
Okay.
So really we followed them for 5 years.
Well, my question is the 90% success rate. What my question had to do with the following percentage, the 50%.
Better.
Can you tell me what that meant?
It means...
Did all of the patients feel 50%
better?
Improvement?
Correct.
Better?
50% improvement.
50% had good.
No. So 90% of the patients were 50% better, at least. So that means that if a patient started out with a pain scale of a 10, they're a 5 and under from there on out. Or more, correct. So we consider 50% better a success. Because if you're living in 50% less pain than what you were before, you may not think about at all having to have a joint replacement. And this is just at least 50% better.
Thank you very much.
You're welcome.
Where would you put yourself in?
I'm probably in that 50%.
And how long ago was yours?
A year ago in March. Yeah. You see, my pain sometimes would be at nighttime when I be sleeping. You still feel that pain. You turn this way, you got that pain. None of that pain, all that pain is gone. And that's the same thing Isaac said. He said, I don't even feel my knee popping anymore. So that was very good for him only after 2 weeks. But he had the umbilical cords himself. Well, I had my own. And his went to work, it seemed like a little bit faster, it seemed like. Now, is it 100% improvement? No, not yet, because it's only been a year. I didn't expect it because once I did my research on it, I said, well, I know I'm not going to get 100%. There's nothing in medical science that's going to get you 100% better that quick. That I do know. But for me, not to have that pain, to still be able to play basketball, to keep the weight down, that was big. And it's all about quality of life for me.
So when he came back a year later, would you expect it to increase another 50%?
Yeah, it still can, because we know the stem cells grow for 2 years.
They do, okay.
Yes, and then you'll continue to keep that cartilage. We have studies out for about 5 to 7 years that it'll maintain that cartilage. If you're very active, you may need an injection, another injection a little sooner than others. But another injection or a pill that you can take certainly would be debilitating surgery. That's what we're trying to avoid.
So how is the treatment different, if at all,
Yeah.
between structural stuff like knee treatments versus ulcerative colitis?
Versus ulcer, how does it differ? I'm going to let Darryl. Do you have any other questions for Darryl? Thank you so much, Darryl. Yes. So how does it differ from ulcerative colitis or autoimmune conditions? So it's very similar. We know a stem cell can turn into any type of cell in the body. And what happens is the body that has damaged cells sends off these paracrine signals that attaches the stem cells when we inject them through the IV. So when they attach to the colon or they attach to the brain tissue, cartilage tissue, it's going to be the same. The stem cell can divide, grow, and develop into what's damaged. So if it's muscle fibers or colon lining versus cartilage versus nerve, that would be just how it differs. But the stem cell will find the area of inflammation based on those paracrine juice signals that the body gives off.
But the only real difference is between a site injection versus intravenous.
Correct. So yep, a site injection into the joint, whether a knee, a hip, a shoulder, versus intravenous through the IV. We don't put platelets through the IV because platelets have a higher incidence of clotting, so obviously we would just do the stem cell through the IV. For the COPD patients, newer science is showing if you inhale the stem cells, you can have some increased results as well. So now we had a patient upstairs today who had COPD, and we did IV stem cell along with the inhaled nebulizer. There's some studies out right now where the stem cell transplants to the lungs is occurring. So really neat. A lot of things are happening. Yes?
Do you have any study on how the stem cells work with cancer patients, people who have had radiation or chemotherapy?
Right. So cancer patients, you know that stem cells have been out for a long time to treat blood cancers, such as leukemia or lymphoma. Right now, we don't know if a stem cell can turn into a cancer cell. We don't think it can, but that's the only contraindication that we have right now. If you have active cancer, we don't give it through the IV. Until the studies show, which it's kind of interesting because stem cells treat blood cancers for a long time. But now they're saying, can a stem cell turn into a cancer cell? We just don't know that yet. Yes?
Is there a different price point for the different injections? Like if you just had stem cell, is there a price point difference between the 3 different?
Yes. So for a long time, we had the same price point with umbilical and adipose, your own fat, because we want to figure out what was going on and what's happening, and now we're just adopting the umbilical, and we want to see the results for our own. The price point was $4,400 for one knee or one joint and $6,600 for 2 joints. The cost of goods for the umbilical stem cell is now a little bit more, so now we have to pay for the umbilical stem cell, which is normal that the cost is going to go up. So now for umbilical stem cell, it's going to be $5,900 for one joint, and then $1,000 for each additional joint. So $6,900 for 2 $7,900 for 3. I had a pro football player that did shoulders, hips, knees, everything. We get vials of 30 million stem cells when we order our stem cells in. The manufacturer recommends you get at least 10 million stem cells per joint, and so we are able to separate them out into different joints with one vial. So if you would get two joints, you would have 15 million, which is over and above what the manufacturer recommends. So then you're just paying for the next joint injection. Yep.
So how do you price your intravenous like for ultrasound?
Yep, so intravenous would be the price for one vial, so $5,900. Yep. So one vial of stem cells we can separate out into whatever area that you need. Yes.
I'm a little confused. So if you have the IV for an autoimmune disease, like
Yes.
I think you said it knows where to go, what to target.
Uh-huh.
So, I mean, if you had a bad shoulder and a bad knee,
Yes.
wouldn't it go and fix both of them?
That's a good question. So we do back pain, neck pain, arthritis with IV stem cells, and patients get better just with intravenous. But the joints, the larger joints, are very easy to get into. So we know that local stem cells, and a lot of studies are made on local stem cell injection directly into the joint. So that's what we do.
They stay there in that
Right.
area?
With the hyaluronic acid, it proves that they stick to the bone or stick to the desired tissue where we want it to grow. So that's why we use that hyaluronic in the joints.
Do you do anything for neuropathy?
We're getting there. There are some studies on neuropathy and PRP and stem cells. Not a whole lot right now, but we do have a couple patients that we treated with neuropathy of unknown etiology. So whether it comes from the back, or is it coming from diabetes, or is it coming from insufficiency somewhere, or is it coming from a previous traumatic injury and they're having neuropathy. The problem is finding exactly where the nerve is pinched and where is the nerve damaged at. So, ultrasound guidance, which is what we use on all of our injections, finding the nerve, finding where it's pinched, putting the PRP in that area, and letting it regenerate and grow. We've trialed it on about 2 patients so far. 1 responded, 1 didn't. And the question is, did we get the right spot on the person that didn't respond? So doing a little bit more research on that it's coming. And there are some doctors that are already injecting the nerve, right where it's pinched to help with neuropathy. And that's a tough one because there's not a lot out there besides Lyrica or, the nerve pain medications that people are taking. So it is coming. Yes?
With UC, is there a differentiation between the times of treatment that makes it more effective, like is it better to treat during remission or during the flare-up because of these signals that the cells send out?
Right.
Under duress, or obviously under more duress
During a flare-up.
Yeah.
Anytime. So if you're under a flare-up, you're going to have the same paracrine juices that the body gives off so the stem cells can attach to, versus when you're still in remission, but you still have TNF factors and inflammatory factors that the body does give off, even if you're a mild colitis.
So there's really no difference that you're aware of.
Correct.
No reason to wait until it's
Correct. Absolutely. Yeah, you actually don't want to go into a flare. We want to keep you into remission. And so the patients that have autoimmune conditions, we keep them into remission for about 9 months to a year. But we also change over your diet, as we talked about the autoimmune conditions, to more of a plant-based diet. We give out supplements called prebiotics and thylakoids and have you stay on a pretty good diet because we know there's a link between the gut microbiome and the autoimmune condition.
Okay, thanks.
Yep.
Okay, just like you said, the knees and the hips, they can't be replaced. What about spinal cord injuries that have been fused?
Spinal cord injuries or spinal fractures that have had herniated disc that's been fused. Okay. Right, so what about that? There are some studies where they actually inject stem cells directly into the spine, not for fusion. So once you're fused, there's no viable disc space there to regenerate the cells. But a lot of times from a fusion, you'll get an adjacent, which means either the upper disc level or lower gets pinched.
They want to keep going down more and more.
Exactly. That's very common in fusions because all the pressure that happens on the upper or the lower disc from the fusion. So IV, umbilical stem cells, plus something called acoustic wave. Acoustic wave is a thumping therapy that we put alongside of the spine, and it helps to awaken your own stem cells, decrease inflammation from the nerves, break up muscle spasms, break up scar tissue. So what we've done is acoustic wave therapy once a week for 3 weeks, as well as IV umbilical cells through the IV.
What happens if you have 3 conditions? Because I have Hashimoto's muscle,
Okay.
and so that's in your autoimmune condition, and then
Yes.
I have.
So any,
I'm already on this knee.
Yeah.
My knee problem.
so any autoimmune condition, IV stem cells will go to the area of inflammation and find that area and decrease it. So what I would do probably is an injection in the knee as well as IV for you and put you on a good diet. So there's a lot of things in regenerative medicine that we can do and that we offer to our patients. All the studies that we know, we put it all together and offer everything for you. So we are going to do consultations tonight. Yes. So once we get into kind of more specialized, individualized cases and conditions, I would love to do a consult. We have Dr. Moody, who's in the back as well, who specializes in our regenerative medicine here in Livonia. And we have another physician assistant, Vanessa, who is upstairs as well. And we have time for free consultations today where we can go upstairs and get you booked for treatment, talk about if you're a candidate. We also, if you don't have time to stay today, have telemedicine consultations to go in your individual health history and figure out what would be the best treatment plan for you. So you would just schedule with one of our medical assistants in the back there to put down a date or a time that we can give you a call in the comfort of your own home, so you don't even have to come in. Or we do in-office consultations as well here in Livonia up on the 4th floor. Shelby Township, we have an office in Clarkston, Warren as well. So whatever is the closest to you, we're definitely able to see you in the office or over the phone. But if you have time to stay today, we would love to get you on the schedule if you're ready for treatment and go over your conditions. Today, if we do see you, Allure does offer, which we talked about, we have some consultation spots, $200 off per joint. Today, if you stay for a consultation and we deem you appropriate where it's time to have the stem cell treatment, you would have a $500 deposit and then you'd get $200 off your stem cell treatment for coming today and doing the consultation and being at the event.